Okay, so let's go ahead and get started. I'm glad to have everybody here. Today we're going to be talking about caregiver stress for the first part of the webinar, and then we'll move in the second part of the webinar to specifically talk about managing the holidays while being a caregiver and what kinds of strategies you can put in place so you're not stressed out. There's also an article that came out, I wrote that came out last week in the Village News, and you can access that online as well. And it is how to do the holidays with stress less. Okay, so we want to make the holidays enjoyable, and we have an extra layer of stress on the holiday season given the pandemic. So everything's different. That doesn't mean we still can't have a great holiday season. We just need to manage it well. If you're on the call, go ahead and mute your audio so that we don't have interference. That would be great. And then I will open it up for questions at the end, and then everybody can just open up their audio. So here we go. What is a caregiver? So a family caregiver refers to a non-professional who provides unpaid care for others in their home. He or she is responsible for attending to the daily needs of another person, specifically in our case for an elderly person. They are responsible for the physical, emotional, and often financial support of another person who is unable to take care of themselves. The person receiving the care might be a member of the caregiver's family of origin or family of choice, a special friend, a partner, a neighbor, a spouse. We receive care from all kinds of different people. These informal caregivers, which some of you on the call are just that, you didn't get trained for this job. You know, you inherited by default. You're the only person who could do it, or the only person who wanted to do it, or the only person available to do it. And so now you've gotten a crash course in caregiving. Caregivers typically spend, and I'm just going to go through some numbers here, so just sort of bear with me because I'm going to lay the land of what it looks like to be a caregiver. Caregivers typically spend about 20 hours a week for caring for that recipient. So that's equivalent to a part-time job. 7 in 10 caregivers, so 73%, are also employed outside the home. We see a lot of this in what we call the sandwich generation, which tend to be women my age, still working, still responsible for children, and taking care of my parents. Nice. Two-thirds of employed caregivers report that their caregiving causes them to have to make changes at work, going in late, staying late, leaving early, taking time off during the day. 1 in 5 report taking a leave of absence. 6% quit working altogether, and 4% take an early retirement. So, you know, this caregiving trend, this informal caregiving trend, cascades, as you can see, across lines and affects many people. And again, we see this a lot, you know, in these adult daughters who are still managing children, managing a job, managing their parents. They are classic sandwich generation caregivers. So what is the role of family caregivers? Well, you kind of fill all these roles. You're the social worker, you're the nurse, you're the housekeeper, you're the financial analyst. I mean, you got you're the taxi, the Uber, the Lyft. You are managing many, many different roles. But essentially, you provide assistance to your loved one with their activities of daily living, right? So eating, dressing, bathing, grooming, household tasks, shopping. You provide transportation, you run errands, you monitor their symptoms, you manage prescription medications, you perform extra household tasks because that person is no longer able to do fewer things. Perform different procedures at home. You may be managing a cath bag that if your loved one has a catheter. You may be having to manage incontinence care. There's other procedures. You may be monitoring your loved one's blood pressure 3 times a day. You're also managing that person's emotional reactions to their illness. You know, because people who are ill, or chronically ill or terminally ill, are going through their own process of grieving and acceptance. And so you as a caregiver are also managing that. So what does that mean? That means a lot of stress. There's a lot of satisfaction that comes from being a caregiver. I know I've done it personally and professionally, but there's also a lot of stress. And so the idea is to manage the stress so that it doesn't take over your life. If you are a family caregiver, especially for somebody who's got dementia, your loved one that you're taking care of, his or her world has gotten smaller and smaller and smaller. So by default, or kind of what I call the domino effect, you as a family caregiver, your world has gotten smaller and smaller and smaller. And so what my role is to encourage you to keep doing some of the things you do in your normal life that are very much apart from your caregiving, so that you can stay sane emotionally and that you can stay healthy physically. Because what happens is caregivers, family caregivers, end up being my secondary patients. They end up in the hospital. They end up sick. In the case of dementia, sometimes the caregiver, the well spouse or person, ends up dying before the person with dementia.
Yeah.
So, right? And so you really have to manage things. I mean, you could have something like mild hypertension, okay, that's, manageable, but add the layer of caregiving on it and your blood pressure skyrockets. So something that was a manageable problem can become, deathly and very serious. So it's so important for you to manage your stress. And I love the metaphor that Lisa Gibbons uses, and it's the oxygen mask. Put on your oxygen mask first. So, right, you're traveling on an airplane. This is the metaphor. And the flight attendant is doing their little deal while you're taxiing out to take off, and says, if we have a drop in the cabin pressure and you're traveling with somebody who is dependent on you, whose oxygen mask do you put on first? Yours. That's right. Because then you're in a better place to be able to take care of that person. It is the same thing with caregiving. You must, I don't care what it takes, you must take care of yourself in order to be able to take care of that person. In the case of dementia, you could be in this race for a very long time, So if you go out too fast, you might crash and burn and get sick. All right. And I use the metaphor, my example, because I'm a runner. I say, okay, let's say I think I'm going out for a 3-mile run. So I'm going to run, pretty quickly because it's only 3 miles, but I get a mile into the run and I find out this isn't a 3-mile run. It's a marathon. It's 26.2 miles. Well, I've already gone out too fast. So I'm not going to make that 26.2 miles. I'm going to crash. So same thing with this caregiving. You have to think of it, especially with dementia, as, you might be in this for a while. The average person that's diagnosed with dementia, from diagnosis to death, lives 8 years. Okay, that's a long time. And some people, that's the average, right? That's the mean. Some people live a lot longer. I worked with a family where a couple, the woman took care of her husband for 20 years. He was diagnosed pretty early and he lived a long time. And when he died of complications due to lung cancer, not from dementia. So you got to get the mindset of, I've got to pace myself. I've got to take care of myself in order to get through this race. Okay. So again, in terms of family caregivers, family members and friends provide most long-term care at home. Most people with dementia are taken care of for the entirety of their disease at home. So even though we have all these assisted living communities and we have home care and we have daycare, most care is provided for the entirety of that person's disease by a family member or close friend. 58% of care recipients who are 50 years of age or older live in their own home, and 20% live with their caregiver. Only 11% live in a skilled nursing building or an assisted living community. And when we look at the money, we can see that contributions given by informal and family caregivers add up to about $375 billion each year. And that's money. That's not time. That's not emotion. That's not how it affects the entire family, right? Because Deciding to be a caregiver is not just about the caregiver or the care recipient. It's about the entire family system, because every relationship in the family is impacted. So when I'm really working with families and they're deciding, do I keep my loved one at home? Is it better to go to assisted living? Do I bring in-home care? We look at the whole system. You know, how's it going to affect your kids? How is it going to affect your marriage? How is it going to affect your own mental or physical health? We have to look at the whole picture. We tend to, because the disease of the person who needs the care tends to take the forefront, we don't consider the whole picture. And that's really a mistake. We have to look at the whole picture because everybody is impacted. So what is your role of your caregiver when the person's in long-term care? Even if they're in assisted living or they are in a skilled nursing building, you're still visiting. You're still advocating for that person. You're still sticking up for them, making sure they're getting the right care, making sure that things are done correctly. You're making sure that your loved one is getting stimulation, right? You know, my mom's in a facility. I make sure, you know, what activities are going on? What is she able to do? What kinds of activities are they bringing to her via things that she enjoyed in the past? You are also communicating with the facility staff, and that can be stressful. You're helping your loved one adjust to a new environment. Nobody likes change. Nobody likes change. And the older that we get, the harder it is to change.
Yep.
It really is. And that transition from leaving your home and going in, even though it might be a beautiful assisted living community with great care, it's still hard because you're giving up, your loved one is giving up a measure of their independence. And it's hard. It's hard. So you're helping them through that as well. And if you're the family caregiver, you're also going through your own emotions about that. You know, oftentimes people feel guilty. I told her I'd never put her in a place. I said I'd take care of him at home forever, but I can't. You know, I didn't count on dementia. I didn't count on my own physical health deteriorating. And you have those emotions and the sadness and the loneliness, and then even feeling guilty that you might feel relieved. I've had family members say, you know, God, it was so great just to be in my home alone and I didn't have to worry about him, you know, and then I feel guilty about that. So there's this gamut of emotions that happen once we transition somebody. When you look at the kinds of caregivers that we have, it's a multidisciplinary team. So clearly the family caregiver is the one running the show, but you're working and advocating and liaisoning with the physician, with the nurses, with the social workers, maybe with the chaplain if you're doing hospice, volunteers, there's art therapy, there's physical therapists and occupational therapists and musical therapists. So those are some of the resources. So again, we look at this model, again, it just shows you how many contributors there are to the care of your loved one, whether they're at home with you or in a facility. So you've got a physician, all right? You're usually going to have a social worker, the nurse, and then you as the caregiver and your loved one, the patient or the client. And then there's other team members too, depending on what level of care you're looking at. Okay. Let's skip through this. This is what I want you to, and this is what we do at the foundation a lot. So they're social workers, but we call them care advocates. They are instrumental. I mean, we love the physicians and the nurses and they do all that medical care, but these advocates, these social workers really do all the wraparound pieces for your loved one and help you organize that. So they will make referrals to other agencies or family counseling. They provide counseling and support. I mean, I watch our care advocates at the foundation work tirelessly on the phone, in person, making home visits. They provide counseling, support, crisis intervention. You know, somebody falls and all of a sudden we have to make a change. That family needs support. They intervene. They promote communication and collaboration among other team members. They'll advocate for your loved one and for you in different settings, whether that's working with an ombudsman or working with long-term care insurance or working with referrals for home care. They encourage families through challenging events. I've watched them walk families through different kinds of things that happen, because you know what? Life doesn't stop. The other stressors of life don't stop just because now there's a long-term care situation, a caregiving situation in there. So now the caregivers are dealing with life on top of caring for this person. And our advocates will walk you through that. They'll educate you, include you in care planning and medical decisions. And by the way, you know, for the person, even with dementia, as much as possible, I would encourage you, and we encourage you, to keep that person involved in their own decision-making. Because what we want to do is focus on what the person can still do rather than what they can no longer do. So you see, it's an additive model, right? A positive model versus a negative or deficit model. Most medical models focus on what the person can't do anymore. So what we want to do is focus on what they can still do and help them do those things. So if you're a family caregiver and your spouse can still get dressed, but you need to lay out the clothes for him, by all means, let him get dressed. I don't care if it takes an hour and a half for him to do it. Let him do it. Because that's going to keep him as independent as possible for as long as possible. And believe it or not, by achieving those things, even though it takes him longer, his self-confidence and dignity are still intact. Now, it's easier, I know it is, as a caregiver, sometimes just go, oh, to heck with that. You know, I'm not going to lay out all those clothes and take all the time to let him get dressed. We need to get to an appointment. I'm just doing it for him. That's easier for you, but that's not what's best for that person.
No.
Right? Okay. So these advocates understand, and they've been doing it for years, they understand the big picture. So they'll give you referrals. If we can't help you at the foundation, we'll give you referrals to other resources. We'll help you with things like housing, apply for entitlements like, you know, VA aid and attendance, or we can walk you through the long-term care insurance coordination and getting that started. We have transportation. We have the caravans at the foundation that we can help coordinate transportation for people. We coordinate care across settings. You know, somebody's being discharged from skilled. We're in touch with that social worker and the nurses at skilled to see exactly what that person needs. And then we organize that for you at home. We help you prepare for safe discharges from the skilled buildings or from a hospital. So you can come home, your loved one can come home, and you have the resources that you need. Okay. I'm going to skip through here. Okay, so what we also do is, and we want to do this to alleviate stress, is really come out and visit with you or visit with you on the phone and define what do you need. And these are the questions we ask. What type of help does your loved one need to stay home independently? I mean, that's really the goal. We want to keep that person home as long as possible. What type of help might be needed in the future? So planning ahead is really important, because in this scope of caregiving, you don't know when you're going to get a crisis moment. Now, your loved one might be doing just fine, and then he takes a fall and breaks his hip. Then what? And if you don't have some little kind of a roadmap outlined, then you're in a mode where you're in crisis decision making, and it's really hard to make decisions. We all know this, right? When you're in crisis. So we want to plan ahead. What might be needed in the future? If my loved one needed home care, what's an agency that I would identify? Make a list. If my loved one absolutely needed to go to assisted living, where do I want to go? Go start looking at some places. You don't have to put any money down. You don't have to make a commitment, but just have a roadmap so that if something does happen, you can put your plan together fast. Who will take charge of making arrangements for care? So a lot of that is, you know, it within the family. Who's the power of attorney? Who's the decision maker? How much money is available for that, your loved one, to pay for care? Does he have long-term care insurance? Does she have a house that she can sell and use those assets? Are you as a family in a position to help financially? And believe me, it's really important to look at that realistically. The finances really drive a lot of this.
Yes.
Will insurance cover any services? And you should know that insurance, you know, our typical medical insurance does not pay for long-term care. You can have a certain number of days with Medicare for a particular illness, but you can't use Medicare to provide for 8 years of long-term care with dementia. It doesn't pay for that.
No.
Long-term care insurance pays for that. A lot of people don't have those policies. What realistically can I contribute to the care? You know, I work full time. So how can the siblings balance it amongst each other? How much is it realistically that I can provide myself? Do I have a job that will affect the amount of care I can provide? Again, a very realistic situation. You've got to look at that. You still got to put food on the table, right? I still have to put food on the table. I still got bills to pay. I can't just quit work. Do we have friends or families that can help? Can we, you know, and then deciding on what kind of care. And I do this with home care all the time. And, you know, I ask people, it's okay. Do you have a preference of color of skin? Do you have a preference of culture? Do you have a preference of gender, of language? Because you want to make that fit the best you can.
No.
Okay. Some other things. How are you doing? And this is what you want to consider with your own stress. If you can't enjoy the activities you previously enjoyed, and your emotional and physical pain and the demands, the physical demands of being a caregiver overshadow all your pleasure, what happens to your self-esteem? Right? Because depression leads to depression. All right. Again, and that's that isolating thing that happens with caregivers. You get depressed. Your world gets smaller, you have less interaction with people, you're not participating in the activities that you once really loved doing, you get depressed. Once you get depressed, your self-esteem plummets. Now you're in a vicious cycle because now the self-esteem is plummeting and then you get more depressed, hence your self-esteem drops even more. It's a very vicious cycle. So what I encourage you to do as a caregiver, let's say you love to golf with the gals 3 days a week, and that's not realistic anymore. Okay, but you could still golf 1 day a week. Don't give it up entirely. Be realistic about kind of redefining your activities, but don't give them up altogether. That's a dangerous situation for you to be in. If you are preoccupied and nervous about your loved one, you're going to start experiencing anxiety. And that's a hard thing to do. And you know, I've seen it and I've experienced it myself. You can develop full-fledged, unpredictable panic attacks. And you don't want to do that. So again, measuring your own anxiety, being able to have them be safe with somebody you trust so you can go do some activities. So you're not preoccupied with them. And you're still going to be worried, okay? It's like having children. I remember going to work for those first weeks after my kids, you know, were babies. And I mean, I was preoccupied, but you will adjust. And as long as that person is with somebody you trust, you will eventually be able to let go a little bit emotionally. Caregiving often involves a range of emotion. With the case of dementia, we call it ambiguous grief. What does that mean? It means that person is still there physically, right? But oftentimes now, and as the disease progresses, they're becoming a shell of who they once were. Yep. So while they're still there and you're taking care of them, you're also grieving because you are losing them over time. You can be experiencing increased stress. The demands of caregiving, especially if you're a senior yourself, are very difficult. If you're managing your loved one's incontinence, you're having to do all the bathing, you're doing all the food prep, maybe you're even feeding that person now, you're ambulating for them, you're getting them places, you're trying, you know, keeping your house clean. You are exhausted, okay? That's where you want to be asking for help. And the other thing about the stress with caregiving is when somebody offers you help,
take it,
accept it.
Yeah.
We as family members get our heels dug in and we think nobody's going to take care of my loved one the way I do. Now, that's true and it's not true. What my response usually to that, because really what that is a feeling and a fear that you're losing your loved one and you want them to be happy and well taken care of. Somebody else, a family member, a friend, a paid caregiver, may not do the care exactly the way you will, but they can get it done. The thing to really note and to tell yourself so you can reduce your anxiety about it is that nobody else can replace the relationship that you have with that person, right? Nobody else can be the spouse. Nobody else can be the adult daughter, adult son. Nobody else can be the granddaughter or grandson. You have that special relationship with that person, and nobody is going to replace that. But somebody else can help you with the care. And that will release you from defining yourself as solely the caregiver, letting somebody else help. So then you can be the husband again. You can be the wife again. You can be the adult daughter or son or granddaughter or grandson again. And there's some relief in that. So you're not all caught up in all the physical activities of managing somebody's care, but you get to reestablish and recapture the relationship part. You may feel resentful as a caregiver because your own needs are not being met, and you just keep stuffing them and stuffing them and stuffing them and saying this person's care is the most important thing. Well, that's a disaster waiting to happen, because it's not a matter of if, it's when. Any of us as human beings can only stuff our feelings for so long before we do what? Explode. You may feel anger and resentment, and that's okay. I mean, these kinds of things, I see the gamut of feelings with caregiver stress are very important, and just be self-aware. Let yourself experience those feelings and do things rather than stuff it. You know, if I'm feeling resentful, okay, what is it I need to do? Okay, I need more help. I can't do this all myself. I'm starting to get really ticked off about it, and I am negating my own needs. So I'm going to hire somebody, or I'm going to reach out to my family and say, look, I can't do this all myself. I know you're all busy with your families and everything, but we have got to figure something out. I need help. And just knowing all the gamut of feelings are totally normal, All right, so again, caregiver stress has an effect on your physical well-being as well as your emotional well-being. And it doesn't matter, this caregiver stress does not focus on one particular group. You know, it cuts across all ethnic lines, education lines, socioeconomic lines. It's an equal opportunity problem, okay? So it can affect your sleep, whether it's you're not getting enough sleep or you have a lot of interrupted sleep because you're up with your loved one, trying to get them up. They're waking, they've got their days and nights mixed up. They have to get up to use the commode or the bathroom. Caregivers start to have poor eating habits, whether that's eating too much out of stress or eating too little or eating too much junk, you know, that's not healthy. Caregiving affects your time for exercise. You can't get sick, right? I used to say this when my kids were little. It's like, moms can't get sick. We're just not allowed, right? We got to keep taking care of the kids. You're caring for an elderly loved one and you get a cold, or God forbid you get COVID, right? Then what happens?
COVID.
Caregivers start
Reality
postponing
nowadays.
their own medical
Not even
appointments.
the flu no more. From the flu.
The flu. If everybody could just mute their audio for me for right now, and I promise I'll open it up for questions. Thank you. You start postponing your own medical appointments. Do not do that. And I know it's easy to do. It's like, oh gosh, you know, my husband had a really rough night last night. Nobody got any sleep. I'm just going to call my doctor and reschedule. And pretty soon your own appointments get put off and put off and put off until now you've got a real problem. Caregivers are also at increased risk for depression and excessive use of things like alcohol, tobacco, and other medications or drugs. You know, again, trying to numb that feeling, numb the stress, when those things only make your health worse. And I would caution you really about the alcohol, and I've seen it so much with caregivers. And alcohol, well, for the first few minutes might make you feel better, it's really a depressant. So it only makes the problem worse. And then you isolate and you keep getting inside your own head, and it's a disaster. So really watch these things, and especially as the holidays come on. I mean, there aren't as many holiday gatherings and things where there's food and alcohol with COVID, but you still need to be mindful. Okay. So I want to move over. I'm going to talk about this little graphic here, and then we're going to start talking specifically about the holidays. So there's this graphic. I want you to take a look at this. You've got physical needs, emotional needs, social needs, and spiritual needs. You need to really look at these. And this PowerPoint will also be on the website. Teresa's got that, and she's going to post that for you. But how can I take care of my body? I really encourage you to get exercise 4 to 5 times a week, even if it's for just 10 or 15 minutes. Physical exercise is one of the best psychological interventions for depression, for anxiety. You produce endorphins when you exercise. They're happy hormones. They make you feel better. Hey, Dawn, can you please mute your audio for me? Dawn, can you hear me?
When you pick a slab and we could start coordinating. We were going to go by there.
Can you mute his audio?
I find out what we had to do. And when I talked to Oscar the other day.
Is that Dawn's or is that mine?
Oh, no, it's not Dawn. Okay, somebody else. Let's see.
I can hear you.
You've got your audio on. Can you please turn it off? I don't know who it is, Teresa. Is it Joan? No? I'm looking.
I think it might be Leslie.
Ah, okay. All right. Yay. All right.
Thank you.
Got her. Okay. So try to exercise. And when I say that, pick something you like and pick something that's convenient. So, walking is great. And we have such great weather here. If there is a gym open and you want to go to the gym, you got to make sure it's close to your house and that it's convenient and you can get there. If it's 10 miles from where you live, 20 miles from where you work, it's unlikely you'll get there. Pay attention to your own body's signs of stress. Are you feeling your heart rate going up? Do you feel palpitations? Do you feel clammy, sweaty? Are your hands sweating? That's anxiety. Just attend your regular checkups, focus on some stress relief. And again, that's doing things outside the caregiving environment. Emotionally, let's move over to that parameter. How can you take care of your mind? Really pay attention to your own warning signs. When I start getting irritable or short with people, I know, okay, something's going on with me because I'm not that way. I have to pay attention. When we don't pay attention is when we get caught off guard and it just gets worse. How do I process my emotion? Is there somebody I can talk to about this? And it may not be a family member. Maybe it's a counselor. Maybe it's a pastor. Maybe it's a friend. Are you taking time for yourself? And again, I don't mean just, taking your loved one out for a walk. That's not time for you. I mean, time totally separate from your caregiving job. Socially, it's very important you stay socially connected. That doesn't mean you have to be the big party goer, but don't isolate yourself from the people you love and your friends and other family members. Make sure that you are reaching out for support if you need it. Don't be afraid to ask for help. And if it is offered to you, take it. Take it. Spiritually, whatever your spiritual convictions are, how can I take care of my spirit? How does stress affect my spirit? I know when I get in a cycle of stress, it's very easy for me to spin out and then I stop paying attention to, I have a morning routine. When I have my morning meditation, I have my tea, my prayer time, whatever it is you do spiritually, make sure that that's a commitment. It's like putting it on your calendar, okay? It's your appointment with your spirit. You've got to take care of that. If you like going to church, if that's something you do, of course, most of them is on Zoom calls now, but there are ways that you can do that. Thinking about what helps you feel connected to something greater than yourself and staying in touch with that and keeping that routine. I know personally for me, when I get out of that routine, everything spins out. Everything affects everything. If I don't keep it all together, right? Get my physical exercise, make sure I'm doing what I need for myself emotionally and socially, physically, spiritually. If I lose it in one category, it spins out and I start to lose it in all the other categories. So keep a routine. We all need a routine, and it'll keep you stable and kind of in your lane, and you'll be able to balance this. Okay. So let's move. We are going to move through this, and we are going to talk about what to do during the holidays. Okay, the holidays, and it's very different this year, right? It's because of COVID, but even without COVID, as a caregiver and as your loved one's disease, whatever it is, progresses, the holidays change. So, and that's okay. The tendency where the stress comes is that we think, oh my God, I have to do everything I used to do. I have to go to that holiday event. I have to go, we have to go see this family. We have to go do this. We have to do that. I need to take the grandkids to the, the Nutcracker. I mean, you don't have to do everything the way you used to do it. And it's okay to redefine how you do the holidays and those traditions. You want to balance your priorities again and thinking about your own health. It's okay to be a little selfish on this, because if you don't stay healthy and balanced, I mean, the whole thing's going to blow up. Communicate with other family members. Oftentimes when the holidays roll around, we reunite, right? And some of us have not seen certain family members for a long time. And let's say you are the primary caregiver, but your brothers live on the East Coast and they haven't seen mom or dad for a year. They haven't seen them since last holiday, right? They may not understand what's really happening. So you need to make sure you're communicating with them. I get this a lot, especially with dementia, because someone in the early stages of dementia, they can kind of pull off a 10-minute phone call. So if brother Bob's calling from New York and he talks to mom who's got dementia, and you're the caregiver here in San Diego, right? And you're trying to explain how hard this is, but mom sounds fine on the phone. Mom sounds like she's got it together. And so brother is saying, what are you talking about? She's fine. Well, no, you need to come to San Diego and you need to stay here for a few days and see what it's like, because mom can pull it off on a phone call, or dad, for 10 minutes, but you're here more than an hour. You're going to see what this looks like on a daily basis. And oftentimes you cannot explain that. And it's off when they see it. So communicate with those family members. Plan for the health and well-being of your loved one and manage your own stress and time. So we're going to talk about all these things. So every family's different, right? Every person with dementia or any kind of long-term chronic terminal disease is different. You got to think about what your traditions are and have been, and be able to manage those in a realistic way. That doesn't mean you have to completely obliterate them and not have them part of your holiday season. It just means redefining what you're doing, right? So consider your traditions. What is your faith and your spiritual celebrations? What have you done in the past? What do you do in your own family? We want to consider family gatherings, and we're going to talk more about that. This is important. This changes this year, right? And it's necessary. How is Thanksgiving different from Christmas or from Hanukkah or Kwanzaa? How does your family typically do that? And we're going to talk about all those. But again, realizing that each family's different. Each family's traditions and spiritual convictions are different. And so there's no one right answer. It's just a matter of considering what you've done in the past and redefining it, not eliminating it, not eliminating those activities, but redefining them. So what are the challenges? What are you going to look forward to? So you want to balance the caregiver responsibilities that you have with the holidays. What is the relative health of your loved one, physically and emotionally? You want to consider physical fatigue on the part of the care recipient as well as your own. What emotional stress you might be experiencing as well as your loved one. And then we want to look at family communication and relationships. Families are hard, and there is no perfect family. And the stress of being a caregiver with somebody who is ill on top of COVID this year can make those family relationships very strained. Okay, So we want to be talking about redefining traditions. So what holiday traditions are the most important? Make a list, and maybe you're going to do 2 of them, not 5. What has to change? What does your loved one want to do? What do you think, based on the past and where they're at now, what are their most important priorities? Seeing the grandkids, going to the Nutcracker, going to see the tree lighting? I mean, what do you think is most important for that one, the care recipient, and what can they actually handle? What do they need? And what do you need to make some of these things happen? All right. What other support and roles that can other family members fill to help you do these things within a realistic kind of parameter? Okay. So communication, this is key. It's a key to any relationship. And most people don't communicate very well. And because we've got all kinds of underlying stuff about, I don't want to create conflict. I don't want to burden my son. I'm fearful that they'll think I'm weak and want to put me in at home. There's all kinds of things that we tell ourselves that keep us from communicating what we need. But what we need to realize is that relationships will change and have changed as the health of that care receiver changes. As your loved one with dementia progresses through the disease, every relationship in the family changes. And so when we look at things from a systems approach, if you look at any system, whether it's work, it's family, whatever it is, all it takes is one person in that group to change, which forces a change by everybody else. That's how it works. If I'm no longer willing to argue with my mother over things, everybody else changes because there's nothing to argue about. I'm not buying in anymore, right? So knowing that every relationship within the family and with friends will change as a result of the person who's ill as they progress. That will redefine family roles. We want to identify what other family members can do to help you and support you. And even if they haven't done it in the past, not being afraid to ask them. Okay, I hear this a lot about, from the spouse as well. It's like, you have 2 sons in town, or you have a daughter and son in town. Well, let's see what they can do. Let's delegate some of this. Well, but they have their own families, and they have their own jobs, and that's fine. You're not asking them to take over 50% of the caregiving. Maybe you're asking your daughter to go shopping one day a week for you so you can stay home, or come stay with dad for 2 hours on a Saturday so I can go get my groceries and get my nails done. That's not a lot to ask. So be willing to ask, and don't, then the other side of it is you might have overbearing family members or critical family members. I love this. I call them the observant caregivers. They're the ones that, live across town or they live across the country, and they don't want to do anything to help with the care, but they certainly want to tell you how to do it, right? How can you balance your caregiving with your relationships to other family members and with your loved ones? Just be talking about it and ask for help. And don't assume that, we kind of buy into the roles that we've always had within a family. And I see this all the time, usually it's the adult daughter. Maybe there's 2 brothers, and boy, the adult daughter has always been the caregiver. She's always been the responsible one. So naturally she takes on the role of primary caregiver of mom and dad and doesn't ask brothers. So we have to be willing to change up those roles so that we can stay sane. All right, you want to be planning ahead. So, within the holidays, make sure that, medications are filled. You're not having to hassle with that, with crowds. Making sure if there's any appointments that need to be done, I'd get them done now. Don't wait for Thanksgiving or December. The other things to consider during family gatherings. Now, of course, we've got COVID. So, and people are still going to gather. We recognize that, but we want to, if you're used to going, like in my family, we have usually at Christmas, a very big Christmas Eve party where there's, family, friends, the whole family and all friends from years and years and years. There's usually 100 people there. We're not doing that this year. Okay, the party is not going to happen. So, but even with smaller gatherings, you want to consider children, okay? And how many kids are going to be there, and how does that affect your loved one? Is there music and noise? You want to make sure that, and you can't control all these environments, but you want to be talking to your families about not having too much stimulation, especially for your loved one with dementia, because it will make them very anxious. And so you want to have an opt-out. So and talk to your families about this, you know, okay, we're going to come over and do a dinner, but if dad gets upset, we need a room, or he's getting overstimulated, where I can take him there and get him settled down. And you also need to be prepared in your mind. You might just have to leave a gathering. Okay. It may just not be working, and that's okay. And tell your other family members, we're going to come, but we may have to go. And that's just the way it is this year. And that's just the way it is with dad. Reminiscence is really good for people with dementia because their long-term memory is intact. So bringing out older pictures, you know, past pictures of holidays past, when the kids were younger, it's good for them. All right. And if your loved one doesn't have dementia and is cognitively still with it, you know, ask them, how long do you think you want to stay over at, you know, Mary's house tonight? Or, you know, how long do you want to be here? If you're, you know, you're taking them out of the community, how long do you think you want to be gone? Just be mindful and consider them in the conversation as much as possible. If you're used to big gatherings, let's say you have 3 kids and all the grandkids, instead of having everybody together at once, maybe you do separate the smaller families, right? You go to the daughter's house, or the son comes to you with their kids, you know, break them up. The overstimulation thing is really big with people with dementia. So too much going on is not a good idea. What else can you do? You know, talking to your family about having other family members sit with that person and talk to them. You know, don't leave the older person off alone by themselves, you know, but be talking about that ahead of time. Read traditional favorite poems and books. We always read the night before Christmas on Christmas Eve, and continue to do that every year. Prepare an old family favorite dish. Again, this is all reminiscence for people with dementia, but it's good for everybody. We love those traditions. I make these sweet potatoes in orange cups with cinnamon. They're really good. I've done that every year for the last 15 years. Every Thanksgiving, I do those. Play cards, watch a favorite movie together. Work together in the kitchen. So if your loved one with dementia can't do a Thanksgiving meal anymore, obviously, or Christmas or Hanukkah, you can have them take one part of it, or at least just sit with you. Give them a spoon and let them stir something. But involve the person as much as possible, because we all want to be connected, and we all want to feel like we have got a sense of purpose, especially around the holidays. Okay. Okay, so this is, I'm going to end with this, and then I'm going to open it up for questions. We're getting toward the end. So here's just some practical stress management tips for the holidays. Lower your expectations. That's okay. You do not have to do everything you did 5 years ago or 10 years ago. You're in a different situation now. This is the new normal. Recognize your limits. What are you capable of physically and emotionally? Pay attention to your own health. You've gotten older. I've gotten older. I can't do everything I used to do, and I'm not going to try, because that's just going to stress me out. Be realistic. Keep it simple and sane. Make lists and do what's written on them, okay? Prioritize. Like I said, if you've got 5 traditions that you engaged in over the holidays, pick 2 of them. What are the top 2? Maybe what's the top, just the most important one. Maybe just do that. Set limits and boundaries. You know, instead of saying, okay, we're going to go over to Mary's house and we're going to stay, you know, well, she's got this 4-hour thing. Well, maybe you don't stay 4 hours. Maybe you don't come for the whole thing. Maybe you go for dessert instead of the dinner and appetizers and party and all that. What can you say no to? And do it. Breathe, breathe, breathe. Super important when you start to feel stressed, and I've really been engaging a lot in this lately, is just take a few minutes and breathe and slow down. You know, it's okay to slow down. We are so used to multitasking And caregivers are their own worst critics because they think they have to do everything. And you don't. You don't. And you can be slower at things. Be kind to yourself. Okay. Exercise, eat well, take time for you. Do some self-care. Go get your nails done. Have somebody come sit with your loved one so you could just go outside in the patio and read a book uninterrupted. I mean, be kind. Practice your faith, whatever that is. Watch the amount of food and alcohol that you consume. Around the holidays, and the stress happens, and there's events and parties and all that, although that's going to be limited this year. We tend to overeat. We tend to eat a lot of sugar, which is not good for our depression and anxiety. We tend to drink more alcohol, which is a depressant. So if you're already stressed and depressed, it can make things worse, not better. So watch that. Just be realistic. Get as much sleep and rest breaks as you can. Schedule time for yourself. Make exercise a priority. Please do this. It is the best antidepressant, anti-anxiety stress buster that you can do for yourself that doesn't come in the form of alcohol or a pill. And it's cheap, it's inexpensive, and it's good for you, not only physically and emotionally, but exercise is very good for yourself cognitively. People have better brain function when they're getting more oxygen and nutrients to the brain. And that doesn't have to be some super strenuous form of exercise, like, you know, you're running a marathon or something. You know, a nice leisurely walk at the pace that you would do if you were taking your dog out for a walk is just as beneficial for you as running 5 miles. And I know, because I used to work in exercise science before I did dementia. So do something you like. It doesn't have to be super overexertion, but exercise. Have some fun. Listen to music that you like. Limit your shopping. I mean, my gosh, we can do almost everything online, right? Amazon and everything else. If you love to shop though, and you like to get out, wear your mask. Don't do it on the weekend when every Tom, Dick, and Harry is out there. You know, go during the week, go when it's the low traffic time so that you reduce your stress and you can actually enjoy some things. All right, lastly, do's. Ask for help to relieve you from as many holiday responsibilities that you had in the past. Let go of what you cannot control and take the initiative to influence what you can. Remember what the holidays are about. This is not about perfection. This is not about, you know, being the best entertainer or, you know, host. Remember what the holidays are about. It's about gathering with people that you love. Reframe how you see situations and people. You know, no family's perfect. We tend to get judgmental. Conflicts arise, especially with stress. Just kind of try to take a step back. Remember what the holidays are about. Release the judgment and let go of the past. Remember the good times. Tell people that you love them. Tell the people that you love them, and just take it all one day at a time and value these precious moments, because none of us know how many we've got left. So remember what the holidays are about. Be kind to yourself. Minimize your responsibilities. Lower your expectations and give yourself permission to not have to do everything you did in the past. You are entitled to enjoy the holidays as well. So make that a priority for you and reach out and ask other people for help. There's no reason why you have to do this alone. We all need a team. We all need a village, especially in the time of caregiving. Okay, I am going to stop recording now.